All right, everybody, welcome to a training session here for exam preparation. It's part of our Fast Tracks program, but every now and then on Wednesday nights, we like to do a presentation that can benefit people preparing for exam preparation, but also give some real life context to things that we talk about. In tonight's episode, we're going to be talking about Article 517, dealing with healthcare facilities. Now, 517 might seem like a very small article, but it's very impactful, especially if you're somebody that works in the healthcare facility construction. So whether or not you're dealing with maybe an ambulatory healthcare occupancy, which is maybe a part of a healthcare facility, or maybe you're doing a medical or dental office and you really don't know what rules apply. But when we're looking for an exam preparation, we're going to try to hit the things that I feel are important for exam prep, rather than an analysis of the entire Article 517. We're going to save that for when we do the analysis of the 2020 NEC. So we're going to be hyper-focused on what you need for exam preparation. Now, good news is most exams, the Article 517 is not going to have a lot of questions that are probably going to be on an exam. So while I'm going to be talking about a lot of information, a lot of this is just going to be good information that you'll take with you if you run into an environment where you're going to be working on a healthcare facility. So again, take it for what it's worth. It's going to give you additional information and understanding. So I will do my best to try to convey that. Before we do anything, we also have to understand that we need to know the scope of 517 for healthcare facilities. What's covered and what is not covered. So that's what we're going to start with. So here's some definitions that we're going to look at, but also what is the scope? Well, this article, being 517, applies to electrical construction and installation criteria in healthcare facilities that provide services to humans, not to pets, not to veterinary facilities. This only applies to humans. So from time to time, we do get that question about, what about a veterinary hospital? Okay, they call it a veterinary hospital, but it doesn't apply to humans, so it's not going to be covered by Article 517. You're going to follow all the other construction requirements, all the chapter wiring methods and chapter 3 and everything else. It's fine. They're all fair game. This is very specific to humans. Okay. Also, there are specific requirements in Part 2 and Part 3, and they not only apply to single function buildings, let's say a hospital, which is just a hospital, which is like a single function. The areas of Part 2, which is the dealing with the wiring methods, and Part 3, which is dealing with like essential electrical systems and Type 1 or Type 2, and whether it needs critical life safety and equipment branches and all that, that can apply to a single function building like a hospital, but it also could apply to a building that has multiple occupancies, whereas the healthcare facility is only one occupancy within that overall building. Okay, so this could be a situation where you have a big, maybe a campus facility occupancy, but one occupancy on that campus is specifically healthcare facility driven. And some of the things that are involved in what gets done in those locations are going to put it in the healthcare facilities category. Now that would be defined by things like NFPA 99. That will be defined by things like NFPA 101. Not something me as an electrician is going to do. The electrical engineer who's designing the system are probably going to work very closely with the healthcare facility administrative staff, because they know what they need, they know where it needs to be, they know what circuits they need here and there. So again, they're all going to work very closely together. As far as an electrician, you're not expected to design any of that. Now that doesn't mean you might not have a small dental office or medical office, and you might be an as-built, you might be doing some things on the fly. And so you need to know these things in 517. Most certainly you need to know them. But again, you're typically, when it comes to things like hospitals, you're not the one making those decisions. Now, you need to make sure you wire things in accordance with the minimum safety standard of the NEC. And you're going to follow the rules in Article 517. And you'll notice that a lot of information that we'll look at gets extracted from other documents like NFPA 99. And so when you look at that, now that is the healthcare facility code, by the way. The NFPA 70, which is what we're looking at today, is subordinate, okay, to whatever 99 is. So where it's extracted from that, you're going to see in the brackets, and a good example of that would be right here. You're going to see that telling you what specific section within 99 document that this information came from. Now, of course, this code panel might modify it for the NEC. They might modify it a little bit for editorial or clarity or editorial changes or whatever. But other than that, it tries to stay consistent with whatever 99 was. Okay. So let's kind of look at some of these definitions. Of course, you have informational notes that will remind you of that. Okay, in case you get lost and you're understanding what 99 is, or where it makes reference to 101, which is an NFPA document, again, life safety code. Again, that's where you see these references to 99, or it could be 101, those type of things. Now, conversely, if you have something in 99, you might see this being 70 in a 99 document because maybe it extracts something from the NEC, okay, electrically related, and it might give 70 and then the colons and then whatever the code reference to the section is within the NEC. So it works back and forth throughout the NFPA documents, by the way. All right, now definitions. We're only going to look at the ones that we feel are critical for exam preparation. Okay, not every single one of them. That means that you, if you're not preparing for an exam or you're just working in the trade, you need to be very sensitive to definitions and make sure you read them and understand them. Of course, if you're in our Fast Tracks program, you can send us questions at any time, whereas you might be confused on a definition or an application. Again, that's the benefit of being in the Fast Tracks program, is you can reach out to us. And on Wednesday night, bring your questions, and I'll do my best to break them down for you. All right, so the definitions that we'll be looking at here in dot 2 are very much germane only to this article. They are not to be used outside of 517. Now, definitions that are to be used broadly are going to be over in Article 100. So where they're used in more than one, so that's 2 or more articles, then that's where the definition would go. Here, these definitions that we're going to be looking at are very specific to healthcare facilities. Okay. So alternate power source, you're going to hear us talk about that quite a bit. That is where you have the normal power that's, say, coming from the utility, or it could be from a generating facility. Maybe it's not utility. Maybe they have a premise generator, and that's, maybe if the facility's large enough that is their normal power. But of course, then you have to have an alternate power source, and that could be one or more generators. It could be a battery system that is permitted. In fact, even now, DC microgrids are permitted to be used as an alternate power source. Again, where it's permitted by the 99, by 101, by the governing body, which is the hospital administration. They're the ones that know what needs to be where and that type of thing. They might make considerations for that, but typically a battery system, where permitted, has to be able to handle the capacity. Again, that's all covered later as we get to that part. But the whole point of the alternate power source is to do what? To provide power during interruption of normal electrical service. Okay? So if there's normal electrical service is interrupted, then we want to have the alternate power source there. And you're going to see that it's necessary when it comes to healthcare facilities, because you could have what's called a type 1 or a type 2 essential electrical system. So it could be made up of critical, it could be made of life safety and equipment branches, or it could be made up of just life safety and equipment branches if it's a type 2 essential electrical system. But all of this is also driven towards certain things that need to be transfer of power between the normal to the alternate power source in 10 seconds or less in order to continue fluidity of power. Loss of power in some of these locations can be detrimental to the safety of patients that are in these facilities. So there's rules that you will have to follow. Okay? And we'll cover those as we get to those through this multi-part series. Ambulatory healthcare occupancy, again, this defines what it is. It has to be able to provide services and treatment simultaneously. It's at the same time for 4 or more patients, and it provides outpatient basis on one of the following here. Okay? The key here is the patients have to be incapable of taking care of themselves. They have to be in a situation or a condition, whether it's through treatment, whether it's through anesthesia, or whether it's an illness or some type of injury, that they are unable to take care of themselves in an event of emergency condition. It means they're going to need somebody else's assistance. So you could have an ambulatory healthcare occupancy that is inside of another building. So the building has its own function, but then inside of that building, you may have an ambulatory healthcare occupancy. Okay? So again, we make reference to this through the code. That's why it's through this article, but that's why it's defined here. So here you just need to know when it makes a reference to an ambulatory healthcare occupancy, that hopefully whoever's designed the system, the engineers have worked with the governing body, which is not the AHJ, it's actually the administrators for the healthcare facility, that they determine what they need and the criteria, and they've designed the system around that. Okay. But incidentally, as you see here, 101 is the life safety code for NFPA. And so this obviously definition and what qualifies as an ambulatory healthcare occupancy is extracted from 101. Anesthesia locations, so anywhere in the code that it makes reference to anesthesia locations, and some of the code requirements in 517 for that you'll notice that we wouldn't know what an anesthetizing location is without the definition of such. Okay, and we're not going to go through every one of the definitions, but I think it's important for exam prep. There's certain ones that we will dig into deeper. Okay? But I just want you to be aware it's here. So if you do get a reference to that as you're working through 517, you know that if you're like, okay, well, what exactly is a anesthetizing location? Because it's giving me all these code rules. Well, that's okay then. What that's telling you is, okay, go back to .2, 517, read what an anesthetizing location is, and now it'll make sense for all the rules that might be applicable to that location. Battery-powered lighting units, we call that unit equipment, typically used for egress, to get out of a building, things like that. So we have a definition of what that is, what an actual individual unit equipment is made of. Now, typically that is also supplied by one of the essential electrical systems, but then it has the battery there, and that is putting out illumination, let's say, for path of egress. That'd be a good example. You've seen these on the wall, the battery packs, the monitoring light, those type of things. But this kind of gives a description of what it's made up of. Now, the first one of the definitions that we're going to look at that we want to spend significant time on is understanding critical branch. Because as we get into this, you're going to see that there are different aspects like critical branch, life safety branch, there's equipment branch, all of those part of an essential electrical system. What does that mean? What are we driving at? So what is a critical branch so that we know what it is when we get to it? It's a system of feeders and branch circuits supplying power for task illumination, which we will see defined here in a little bit, fixed equipment, select receptacles, and again, who selects those? Those are selected and designated by the governing body. Who's the governing body? No, it's not the AHJ for the local jurisdiction. It's the healthcare facilities governing body. They're the ones that know best. So I always try to tell AHJs, don't stick your toe in areas where you don't need to be. Let them designate it. You quantify that the location, it meets all the things within the building codes and whatnot. Let the governing body for the healthcare facility determine what's on the branch, what's on the life safety branch, what's on the critical branch, what's on equipment branch. Let them work with their design engineers for them. Okay, they know their facility better than anybody. Then what you do is have your inspection team come after and make sure that they've met those basic guidelines of a minimum safety standard like we have here. Okay, but let them initially design it out, because again, they're going to be using, like it says here, they're going to be using the criteria that's also listed at NFPA 99. Okay, so all this information is extracted from that. So what is a critical branch, you say? Well, it's a system of feeders and branch circuits supplying power for task lighting, fixed equipment, select receptacles, and select power circuits serving areas and functions related to patient care that are automatically connected to alternate power sources by one or more transfer switches during the interruption of normal power. Okay, so you're going to see here later, probably in part 2 of this series, where we're going to talk about alternate power sources, and you can have more than one transfer switch. And in some cases, you're going to be required to have more than one. But there are allowances. For example, if you have 150 kVA or less, that you might be able to have the transfer switch, in this case an automatic transfer switch. You might have it handling all three of those different essential electrical systems. Whereas once you get over 150 kVA, you're going to have separate transfer switches. Again, you could have more than one. So I could have a critical, life safety, and equipment branch, but I could have, due to the capacity of the building, I might have a lot of alternate power sources, like multiple generators, to supply this building. That's okay. That means you'll have multiple, panels that are part of this essential electrical system. And all it's saying is you may have additional transfer switches because of the power necessary for this facility. And that's all part of the design. Okay. So it's not just, there's a lot of critical branch and individual branch circuits that go out to these task lighting, to this equipment, to these select receptacles that are designated by the governing body. All of those are going to be tied back, and they're part of the designation of the critical branch of an essential electrical system. It'll make more sense when you see the illustrations later, but just kind of understand what we're talking about. And it's important to know these are automatic connections to that alternate power source in the event of a loss of normal power, or interruption, we should say, because it could come external, but it could come internal as well. A dental office, when we make reference to that, so you need to know what it is. Again, one of the key components about this is a dental office is no overnight stay, and there's no 24-hour operations. That should go without saying, but there you go. You do have what criteria under 99 for what's considered a dental office. Okay? Electrical life support equipment, obviously this is equipment that has to maintain a patient's life. Okay, so that would be electrical life supporting equipment we're referenced. Now we'll get into the next branch of what we would have during an essential electrical system. And of course, we're going to see what that is right here, but let's talk about the equipment branch. It's a system of feeders and branch circuits arranged for either delay, or could be automatic, or even could be manually connection to that alternate power source. Okay, and it serves primarily three-phase power equipment. So this is truly an equipment branch, right? So it typically will serve equipment or associated equipment necessary for operation and reliability of things like maybe ancillary aspects of some type of three-phase equipment, or some other ancillary component of that might be on the equipment branch. It might not necessarily be on the life safety. It might not necessarily be on the critical branch, but it would be on the equipment branch. The key thing that you want to remember here is that we're going to call that out. And so the design professional, again, I'm not here to teach you to be a design professional. That should be called out on the drawings. And as far as an inspector or for exam preparation, you need to understand the difference between critical branch, life safety branch, and equipment branch. Because the question is going to ask you maybe on an exam, it's going to be very much driven towards a requirement, and you need to know, because the critical branch and the life safety branches have certain aspects to them that have to be met. You're also going to notice that you have patient care spaces, and it's broken into different categories. Category 1, Category 2, Category 3, Category 4, and there's other rules in there that require things like normal power and life safety to be at certain locations. But you'll notice it doesn't say anything about the equipment branch at those specific locations. So that's why it's so important to understand each branch, at least at the definition level. And you'll see how it gets applied as you go through the code. Essential electrical system. So it's a system comprised of alternate sources of power and all connected distribution equipment and ancillary equipment designed to ensure continuity of electrical power to designated areas and functions of a healthcare facility during disruption of normal power sources, and also to minimize disruption within internal wiring systems. So the interesting thing about the essential electrical system that it starts on the load side of your transfer switch. And that's where you're going to have your critical, your life safety branches, your equipment branch. All of those type of things are part of the central electrical system. It's not the normal power. That is not the essential electrical system. That's normal power. Okay. So we will see a diagram, obviously later, that tries to designate out all of what's a part of an essential electrical system. And we will see that that gets spelled out of the different types of branches that encompass an essential electrical system, whether it's a type 1 essential electrical system or a type 2 electrical essential system. Exposed conductive surfaces, again, it's just some definitions. I'm going to cover the ones that I think you would see more on an exam. Again, this is not designed to teach you all of 517, and this is a supplement to our Fast Tracks program. So let's look at healthcare facilities, buildings, or even portions of the building. So you could have an entire building that might be a healthcare facility, like a hospital, right? But you might have a building that has other occupancies in it, but a portion of that building is being used as a healthcare facility. Of course, if that's the case, it's got to meet all the rules that are associated with healthcare facilities. 517 very much comes into play, right? And you may have enhanced wiring method requirements as well. And we'll see those obviously when we get into part 2, where we look at the wiring methods and so forth for these different types of healthcare facilities. And of course, we'll also see what's excluded from the more enhanced wiring method requirements. Again, stay tuned for that part. That's part 2. All right, so healthcare facilities also could be mobile enclosures in which human now, not animal. Okay, I do get that question from time to time about veterinary hospitals. You wire a veterinary hospital just like you would a normal commercial building. Okay, it's not anything special that would bump it into something called a healthcare facility. Just keep that in mind. But the healthcare facility is for dealing with medical, dental, psychiatric, nursing, obstetrical, surgical care is provided. That is a healthcare facility. Of course, we have an informational note. This is a good time to remind folks that informational notes are great, especially here in 517. They are very well done, but remember, they're just information. They're there to provide you some information. They're not something you can base a rejection on if you're an AHJ. You can't build any argument around an informational note. I mean, people try, but ultimately it depends. AHJ could literally say, I don't care what that informational note says. That doesn't sway me one way or another. But what I find informational notes, again, are helpful as roadmaps to give you insightful information to help you make a decision. So again, while they're not enforceable, they can be very beneficial. Okay? So in examples of healthcare facilities, again, not limited to it, hospitals, nursing homes, limited care facilities, clinics, medical and dental offices, again, healthcare facilities. There's your own rules for that, and ambulatory care centers. Now, again, whether permanent or it's movable or it's mobile. That's why we have the mobile enclosures as well. So you could have something like where we had 9/11 and you have a pull-up of a mobile enclosure facility that would still qualify as a healthcare facility. So you have things that could be for a natural disaster, things like that, that still would invoke it being a healthcare facility and have certain rules that have to be applied to that. So just kind of keeping you aware of it. Now, the next one is this healthcare facilities governing body. You're going to hear us talk a lot about it. Who is responsible for designating Category 1, Category 2, Category 3, Category 4 areas, maybe wet procedure locations, all these type of things? Who's responsible for that? That is the healthcare facilities governing body. The AHJ just makes sure that whatever they decided, that they follow the rules of the NEC. The design professional is going to work closely with the governing body to determine what's in this facility. And at that point, they're going to designate out the different circuits, different locations, different classifications. And hopefully that's going to be on the drawings. And you as an electrician are just going to be able to follow these directions, okay? That doesn't mean I want you to be a blind zombie and just go through it and do nothing but just say, well, I'm going to do whatever they say. You need to have a keen awareness of all these definitions as well as different categories like critical care or general care, basic care, and support care. You need to understand these different locations within the patient care space just to make sure that somebody hasn't missed anything. But it's their responsibility to design it out based on input from the governing body, right? So that's what we're working with. Okay. Let's make sure here that I've got there. All right. Next we've got here is hospital. Well, I think we all probably know what a hospital is, but if we have to define it down to know whether or not we're looking at something and say, is this a hospital or not? Well, it's a building, so we're all probably familiar with huge buildings. But I think the one thing that people lose sight of, it could be a portion of a building. So the overall building may not be a hospital, but a portion of the building might be utilized for what? 24-hour basis care of medical, psychiatric, obstetrical, or surgical care of 4 or more inpatients. Okay, they're staying in the hospital or in this portion of a building that's being used as a hospital, right? And I guess this came about, there was a situation in some jurisdictions where they don't have a large hospital. They might have like a strip mall set up, and one portion of that strip mall, that building, is being used as a hospital, whereas the other side of the building is being used as, I don't know, it could be anything, right? Electrical supply house for whatever purposes. But the actual portion is being used as a hospital. To be a hospital, based on 101's definition, it has to provide medical, psychiatric, obstetrical, or surgical care, and it has to be able to supply it to 4 or more inpatients. Okay, it's not an outpatient thing, an inpatient, that they have the facilities and the ability to keep them around the clock, okay, 24-hour basis, right? Then that would be a hospital. And that's important because when we look at the rules, we need to know that a hospital obviously is a healthcare facility, and we have all these rules that have to be applied to that go over and above what we might have under the general requirements of chapter 1 through 4. Okay, because we're in chapter 5, and they're modifying and supplementing chapters 1 through 7. All right. Next, if you need to know what an invasive procedure, where it makes reference to that, we have a definition for that. Next one that we want to be critical about on a exam is we learned what the other critical branch was. We now need to know what a life safety branch is. Now, again, this is a component of an electrical essential system. The life safety branch, what is it there for? It's a system of feeders and branch circuits supplying power for lighting, receptacles, and equipment, okay? And the equipment that is essential for life safety that is automatically connected to that alternate power source by 1 or more transfer switches, again, based on your capacity and your design and all those type of things, to which during an interruption of normal power takes place. And I will tell you that the transfer power is 10 seconds or less, same as you would for Article 700 emergency system. But we need to make sure that any of those systems that are part of life safety, that's essential to maintain the aspects of life, that they are on this life safety branch. And we're going to obviously look at that as we move through the series here, because it is very specific on what has to be on a life safety branch in terms of the NEC. Again, all of this gets extracted from 99, but here in the NEC, most electricians are going to work with NEC, which is NEC 70. We're not going to, or NFPA 70. We're not going to be working with 99, or most electricians are going to have a copy of 99. So keep that in mind. Limited care facility. When it makes a reference in the code to a limited care facility, what is it? It's a building, again, like a hospital, or a portion of such of a building used on a 24-hour basis for housing 4 or more. So there's a trend here. So if you're on an exam, and remember, it seems to be that all of these locations are triggered by 4 or more patients. Now, a limited care facility is 4 or more patients who are incapable of self-preservation. Why? Because either their age, like the elderly, physical limitations due to an accident or an illness, where they're hurt and the back is broke or something, and they just cannot have the ability that in an emergency, they can preserve their own life by getting safely out of the building or getting in a safe location. They can't do it. So they need help. Okay? Or limitations such as intellectual disability or development disability, maybe something like mental retardation, one of those type of things, or Alzheimer's, that's a dementia or something like that. they don't have the ability to self-preserve their life. Somebody's got to assist them. So the rules get raised up a little bit more for these type of facilities, right? Again, mental illness, and of course, chemical dependency. You have treatment centers where people literally are addicted so bad that once they start pulling them off this addictus or this chemical dependency, they really get the shake. They can't do anything. So they have no way of providing self-preservation in an emergency situation. They need somebody to help them. So that's an example of a limited care facility. Okay? So we have all these definitions, and it's important that you know where to go to find them. That's the key. But we're just kind of giving you an overview of ones that are more important for an exam. A medical office. Same as we define what a dental office is, we also define what a medical office is. Again, the key factor here is no overnight stay for patients, and it's in no 24-hour operation. Okay? You just go in during office hours, not like an emergent care. Okay? This is just like a medical office where you go in during normal business hours to get a checkup, maybe get your blood work checked, things like that. That would be a medical office. Okay? We don't need to go over nursing stations. Again, it's pretty self-explanatory, but we do want to look at nursing home because this is, again, another signification of a building or portion of a building that does what? 24-hour basis. It's used on a 24-hour basis, so it doesn't close. It's still 4 or more persons. That's another trigger, 4 or more. Keep that in mind. But in nursing home, the trigger is because of mental or physical incapacity, might be unable to provide for their own needs and safety without the assistance of others. Okay, so they might be unable to provide for their own needs without the assistance of other people. Some people can in a nursing home, but some inside of the nursing home might not be. So again, very similar to the limited care facility again, but these are for people that are incapable. Notice this one says might be unable to provide for their own needs. Okay? So a nursing home, we tend to think about more towards the aged. They could still get around, but maybe their physical capacity limits them. Okay? And they might not be able to provide for their own needs. Some will not. Okay? So again, the point is nursing home, we're used in the code. We do have a definition. All right, now we're getting to some of the ones that are probably going to be exam type of questions or things that's going to need to associate with an exam. Patient bed location. What's a patient bed location? Well, it's a location of a patient sleeping bed. Okay, that's a patient bed location. Or it's the bed or procedure table of a category 1, which is a critical care space. Now in the 2020 code, we call them category 1. Previous to that, we call it, the critical care space. But remember, category 1, the bed or the procedure table, that is going to be considered a patient bed location because when the code starts making rules around patient bed locations and where they're at, like in a patient care vicinity, then we have to understand that what is a patient bed location? It could be the patient sleeping bed in general, but it also could be the bed or procedure table of a category 1, which is a critical care space, also would be a patient bed location. Now let's talk about an even bigger picture. What is a patient care space? Now we kind of talked about a patient care vicinity, and we'll look at that again, but the patient care space is the bigger picture. It's any space in a healthcare facility where patients are intended to be examined or treated. That's called a patient care space. So we have rules for things like redundancy for equipment grounding and things like that in 517.13a and b. That is very much specific to patient care spaces. It's where people are going to be, or patients are going to be examined or treated. Remember, the lobby or the offices or the dining area of a healthcare facility is not a patient care space. Okay? So, but any space in a healthcare facility where we're going to be examining and treating patients, that is a patient care space. And that just raises the level when it comes to the different types of wiring methods that can be used in those spaces. So we'll look at that, obviously, when we get in part 2 of this series. And if you're in the Fast Tracks program, you'll get access to it. If not, you can become a monthly subscriber, and a monthly subscriber can get access to this ongoing series, and you'll be able to get everything. So for more information on our subscription plan, visit our website, electricalcodeacademy.net.com or .org. You'll see a subscription button at the top. If you like what you're hearing and you like how I'm explaining it, go check it out. And you also get some informational notes that kind of reminds people, because people ask all the time, well, who determines the patient care space in a hospital? Is it the AHJ? Absolutely not. Who determines it? It's the governing body of the healthcare facility. Look, it's their building. They're the professionals. They're the ones that know what's going to be done in this area of the building, what's going to be done in this area, and trust me, for liability reasons, they make sure they follow 99. They make sure that they're doing the best due diligence they can for safety. All the NEC is giving parameters to remind us of this and give us certain aspects for the installer to be aware of as a minimum safety standard. Hopefully, all this gets worked out between the engineer who's designing the hospital or healthcare facility, I should say, as a broader picture, and the governing body. Now, trust me, they do work very closely together, and it takes many, many, many months to determine what goes where. Also, another informational note, again, not enforceable, but good information, reminds you, like I said earlier, the offices, corridors, lounges, day rooms, dining rooms, similar, are not classified as patient care spaces. So they're not going to kick in the additional requirements for redundancy, for example, like in 517.13a and b, and all those things that would be in Part 2. Okay, not going to be required in those areas. All right, next, the different categories. This is important because you're going to have designated space within a healthcare facility that's going to be very specific, whether it's a critical care space, and you're going to have rules in that critical care space. You're going to have rules for the number of receptacles. You're going to have rules for the number of branch circuits that supplies that space. So critical care is category 1, and this is a space where a failure of equipment or of the system in general is likely to cause injury or death to the patient, the staff, or even the visitors. So if that level of criteria has been raised in that space, then that's called category 1. Okay, and you do get some examples here in the informational note. So this is very much to assist you. Okay. Now, category 2, this is general care. Now, this is a space where a failure of equipment or of a system in that space is likely to cause minor injury to staff, patients, or visitors. And it's not going to be major injury, and it's certainly not going to be death. So that determination is made by the design professionals in conjunction with the governing body. They're going to make the consideration for those locations, but we do get an informational note, and the informational note does give us some examples, okay? Like inpatient bedrooms, dialysis rooms, okay? Dialysis rooms would not be critical care. They would classify those as general care, okay? So again, different examples of what would be something versus category 2 versus something would be critical care, like a trauma room. Failure of equipment or the system when you're in a trauma room can result in the death of a patient. And malfunctioning equipment in that location due to fluids and bodily fluids and bloods and all those type of things could have also detrimental effects to patients, staff, or even visitors who might be there. Okay? Maybe somebody's sitting there watching a delivery of a baby, the father or something like that. So that might be something that's elevated to a category 1. So we do get some good recommendations here, but remember, they all come from 99. So the design professional and the governing body are going to work together to classify these different these spaces. They're going to be the ones that do that. Okay. Of course, we have what's called basic care space. It's a space where failure of equipment is not likely to cause injury to patients, staff, or visitors, but it could cause some discomfort to the patient as a result of a failure of equipment or a system. So if that's the case, then it would be assigned as a basic care category 3. And a good example of that would be basic medical or dental care. Again, discomfort to somebody if you had some type of failure, let's say in a dental office. So they might categorize that as a basic care space. And of course, you get some examples of that down here as well. And then you got support spaces. These are all the additional support spaces for where you might have equipment or failure of equipment is not likely to have any physical impact on the actual patient's care. So example would that be like waiting rooms. I like to use the one morgue. So obviously the patients that are in the morgue really are not going to be affected by the impact of that failing system. You know what I'm saying? So the morgue would be a support space. It's not, they're already dead. God, it's kind of morbid, but anyway, you get my point. Now that takes us to the patient care vicinity. Now, the interesting thing to understand about patient care vicinity, again, as I told you earlier, this really works in conjunction with the patient care space because you have the overall space, but the patient care vicinity is a space specifically located where it's intended for examination and treatment of patients. And this patient care vicinities actually has a defined space. And let's say it's a patient care bed. Let's say it's the bed where they're doing the treatment or examination. It actually goes out 6 feet in all directions from the perimeter of the bed, and it goes up 7.5 feet. So this is a zone, if you will. And this patient care vicinity is nestled inside of a patient care space, right? So a space within a location intended for the examination and treatment of patients, and it extends 6 feet beyond the normal location of the bed. And you notice how it says normal location of the bed? Because rooms are designed kind of funny, but it's designed in a way somebody might move the bed to the left or to the right, but the normal location is where it would be situated in that room, maybe based on its orientation to its headboard with its maybe required maybe required life safety and normal branch circuit requirements. It's all where it normally would be placed. Okay? So that's the normal location, and you measure from that. Okay. And again, all this comes from 99. So, Chapter 5 and 517 is not reinventing the wheel here. It's just extracting it from another document. Okay. And again, psychiatric hospital, again, 4 more inpatients. Let's see. Here's an interesting one. You see this brought up a lot. Selected receptacles. We use that term. You saw us use it earlier. What does it mean? It's the minimum number of receptacles selected by the healthcare facility's governing body. Again, they have the ability to select which receptacles they want to be utilized on, let's say, a life safety branch, a critical branch. They're the ones that select it. They're the ones that determine this. And obviously, they're going to work with the design engineer who's very familiar with 99 and all that type of thing. So again, it's not up to the AHJ, the inspector, to say, well, I want that receptacle to be on this or that. It's really up to the governing body. And so I usually tell AHJs, let them make the call. You just make sure that they've met compliance. That's it. Grounding and bonding aspects of it. Make sure there's, for example, no isolated ground receptacles inside a patient care vicinity area, but it could be inside of the patient care space, which is outside in the bigger scope of the room, let's say. You're the one that ensures that is done. You're not the one that pinpoints out what receptacles have to be what. That's the governing body. That's their responsibility. They know their facility better than anybody. Okay? Next, task illumination. We see that term used quite often. What is task illumination? It's the provisions for the minimum lighting required to carry out a necessary task in an area described in 517.34. Now, what is 517.34? We kind of jump to that. You'll see that that's in the critical branch, and it talks about task lighting and select receptacles, again, by the AHJ, are as following. In patient care spaces, including infant nurseries, that's be specific task lighting in there. Medical preparation spaces, pharmacy dispensing. Again, if you lose the task lighting or that goes off in these areas where somebody's administering medication and they screw this medication up, that'd be kind of huge, wouldn't it? So again, that's the example of task lighting as it made a reference to 517.34. Okay, so just wanted to jump to it and let you know that reference. And we'll go back up to where we were. So task lighting, it's to carry out a specific task. And we have to make sure that. Now, here's the other thing. Inside of a patient care space, or inside of, let's say, an operating room or whatever, you have this task illumination, for example, right? I need to get to, say, to the path of egress to get out of the building. So this task lighting could also be germane to getting me safely to an exit to get out of the building. So I might have specific task lighting for a certain area of a healthcare facility that's deep embedded into the actual building. And it's going to get me from where? From where I'm at, through adjoining rooms, to potentially the path of egress to get me out of the building. Granted, the design, the photometrics or the foot candles and the layout of a path of egress should be all on your drawings. And of course, that has to be illuminated. But it's just important that we understand that there is specific task lighting. I'll give you one great example. I would not want to be on a table going through a procedure, have a specific lighting that's designated for that task, and have us lose it during the middle of my procedure. That would suck. Okay, so that's an example of some specific task illumination. I'll also say I would not want somebody providing volatile medical prescriptions, okay, in an area that has to have specific lighting for that task to be completed, designated by the governing body, and then I lose power to that task lighting. That would suck. So you're going to see that task lighting or task illumination is going to be things that are covered under the essential electrical system as we move into part 3 of this series. All right, well, not last maybe, but wet procedure locations. Now, this is an area inside of the patient care spaces that may be a category 1, category 2, whatever it is. You have patient care spaces where procedures are performed that is normally, under normal conditions, subject to wet conditions while patients are present, including things like standing fluids on the floor, blood, as nasty as that sound, IV bags maybe in a location where it's a trauma center, where you've got a trauma room that you have then quick changing of bags and fluid gets on the floor. Maybe they're flushing wounds or whatever it is. That's under the normal course of that patient treatment. What we're not talking about is areas that might be subject to routine housekeeping, like spillage of things and liquids. That doesn't designate a wet procedure, okay? Just because it's tiled and tiled walls and whatnot, no, that's not what we're talking about. Another example of a wet procedure room may be, let's say I have a hydro massage tub, or excuse me, a hydrotherapy tub, and it's there for a procedure, treatment in a patient care space, and you have the tub, and you could have, and that's obviously also covered under 680 for therapeutic tubs, but you have the potential for spillage and water that is just part of that patient's treatment. It's there. It's going to spill. It's going to be in there. That would be an example of a wet procedure location. Not just because we could spill something in an area incidentally, or because somebody might be housekeeping and they're going to wash it down. That doesn't justify a wet procedure location. So it's very much germane to a procedure, and if under normal circumstances you have conditions where you have standing fluids on the floor or drenching of the work area, things like that, then that would be a wet procedure location, again, defined by the governing body, okay? All right, and of course you have other definitions for X-ray and all that. We're referenced in the code. Again, if you don't know what X-ray and all these, you've got them here. All right, so for me and you, that is it. We're stopping with part 1, really looking at the definitions. I've kind of told you the different things that I think that you would run into for an exam. Make sure you understand the different types, limited care facilities, hospital, the definition of that, ambulatory. Again, we'll kind of give you a synopsis here. Hold on. Ambulatory healthcare occupancy. Understand alternate power source and what its intent is. Know the critical branches. Know the life safety branch. Understand the equipment branch, but focus more on the life safety and critical. Understand what a limited care facility is, medical office, dental office, and make sure that you really understand the difference between patient care space and a patient care vicinity, which is typically located within the scope of the overall patient care space. And then, of course, all these different categories are good to look at and good to refresh at. So hopefully you got something out of today's part. If you want more of this series, join our monthly subscription program or get into the Fast Tracks program, and you'll have access to this as well. So thanks for listening, and stay tuned for part 2 as we move forward in our analysis of 517 for healthcare facilities when it comes to exam preparation. That's what we're doing. We're looking at it as far as exams. Until next time, stay safe and God bless.